Thanks for staying with us. We are talking about the health conditions that affect women and men differently. After a discussion on stroke, heart disease, and cancer, we are now shifting to more general conditions that impact our health depending on our gender. So thanks for staying with us, Dr. Kunzweiler, Erin Kunzweiler. Let's talk about men's health. Is life expectancy really that much less than it is with women?
It is. It's about 5 years or so less for men than women.
And why is that, do you think?
Well, part of it is men have a higher rate of death from trauma, especially young men. More motor vehicle accidents, motorcycle accidents, hunting accidents. They have more deaths associated with the work that they do. In general, men tend to do the more dangerous types of work, and so that plays into it. And then men tend to die younger of cardiovascular disease, heart attacks and strokes, and so the net result of all that is that men tend to live shorter lives than women on average.
Okay, and I understand too that men are about 3 times more likely to die from suicide than women. Can you talk about that a little bit? Is that mental health issues, depression? Why are so many men?
Well, we think that depression rates are probably about the same among men and women, but men are more likely to act on it than actually kill themselves. And some of that has to do with gun access and that kind of thing. But it is true that men are more likely to suicide, especially middle-aged and older men. And alcohol is often a factor in that as well.
Okay. So what's the solution there? What should men do to get help, or why are they not getting help and turning to suicide?
Men are less likely to seek help for depression. I think there are attitudes that are in our society that men are supposed to be strong, and it's a sign of weakness if you cry or you feel
Sure.
down. You're supposed to just suck it up and keep going. So I think if you feel that something's not right in your life, you should go talk to your primary care provider about that, and they can do screening for depression and get you some treatment.
Okay, great. So men are higher in suicide rates, but women are actually higher when it comes to depression. So maybe Erin, could you take that one on a little bit? Why do you think women are higher in depression?
Well, I think the incidence of depression, as Doug was saying, is fairly equal, but definitely I think more women seek out treatment for it. And again, probably because there's still a stigma about mental illness in our country. And there is, good treatment for depression, both pharmacological or medications and counseling. And I think too, a lot of symptoms of depression, we think of the common ones, you feel down or you're having crying spells or hopeless. But a lot of times symptoms are physical, so lack or inability to sleep or sleeping too much or lack of appetite, weight gain, weight loss, even headaches and stomach aches, that don't have another etiology for. So I think, in general, women seek treatment for all of those kinds of things, but I think it's important to know that that the physical manifestations may be the only ones you have, and I would encourage men and women to seek treatment for those.
Okay, great. Thank you for that. And so we talked about that women do live longer than men. Are there other health conditions or issues that affect women more than men, especially as we age?
I think we tend to screen women more for things like osteoporosis, for example, but men get osteoporosis, just as much as women do. So I think it's important, really, as opposed to separating, to think about, that we need to be looking at both genders equally with those kinds of diseases.
Okay.
Are there any ones that you can think of?
Well, osteoporosis, I think, is one of the big ones that we think of as being exclusive to women, and certainly that's not true.
Right.
Men, have a lot of trouble with their emptying their bladders as they get older, and so that leads to a variety of things that women generally don't suffer from. And I think women have a lot of pelvic conditions because of their different anatomy that they get into as
And
they
even going
age.
back to depression, I think we have to remember with women that they're is perinatal depression, postpartum depression, there can be postmenopausal depression, so things that are more unique to women because of those life changes, that men don't have. But again, back to that with pelvic issues and urological issues with women, just because of the nature that, you've given birth or whatever, that's more unique to women as we age than men.
And I think, we talk a lot too about hormones with women because of menopause and some of the other things that they go through with estrogen, but there are things that men can go through with testosterone too, right? Health issues that happen if testosterone goes down, those kind of things.
Yeah, and there are things that are actually caused by trying to treat another condition. Men with prostate cancer are given drugs to counteract testosterone, and that can lead to problems, osteoporosis being one that comes to mind readily.
Okay. Maybe we could talk a little bit more about prevention. Are there different preventative, recommendations or guidelines when it comes to men or women, especially when we talk about vaccinations?
So no, in regards to vaccinations, and I'll just go through, the recommended ones. We recommend getting your influenza vaccination on a yearly basis. We recommend the shingles vaccination starting at age 60, and there is a new shingles vaccination that has just come out, and it is supposed to be more effective than the previous one, so that it's recommended to get that one even if you've had the previous shingles vaccination. There's 2 pneumonia vaccinations starting at age 65 that men and women should get, or they should get it earlier if they have underlying diseases like chronic lung disease or diabetes.
Shouldn't forget tetanus. You should get a tetanus
and your
booster
tetanus every 10
years.
years, and that has the pertussis in it also. So.
And there's no real difference between recommendations for men and women as far as I know of.
Okay.
We've talked about vaccinations.
Okay. And we've talked a lot too about prevention as far as healthy eating and not smoking and watching your alcohol intake and those kind of things. Are some of those recommendations different? Obviously, we know men are built differently than women. So what are some of the recommendations there as far as exercise, healthy eating?
I think for women, we start losing our bone mass in our 30s, and we don't really start thinking when we're 30, about osteoporosis when we're 70. So it's really important even for younger women, to have a good intake of calcium and vitamin D and fruits and vegetables and fibers. And for both men and women in regards to physical activity, when we know moderate physical activity most days of the week is a reasonable guideline to use, but I would encourage people to incorporate weight training into their physical activity regimen for prevention of osteoporosis.
Helps to prevent falls too. It's been shown that if you carry more muscle mass into your later years, you're less likely to be bothered with falls and fractures.
Physical activity for all of the things we've talked about, heart disease, stroke, and cancer, is a good prevention for all of those.
Perfect. Okay, thank you very much, you two. We're out of time, so that's all we have for this week. We hope you'll join us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.